Dear colleagues, a very warm welcome to you to e-learning course Infection Prevention and Control, a primer. I am Dr. Ranga Reddy, a physician, healthcare enthusiast, and President of Infection Control Academy of India, which is working towards creating a bandwidth of infection preventionists in India and other low resource settings. This course, Infection Prevention and Control, a primer, is a collaborative course which is being offered by University of Hyderabad, Commonwealth of Learning SEMCA, along with Infection Control Academy of India. Today, we are going to have the module which is going to take care of basic concepts of infection prevention, which includes core components and IPC terminology. I am sure you would have enjoyed the module 1 from my colleague who has talked about the infection control and prevention as a science and also its role both in the communities and also in healthcare system. Now today we are going to structure our module in the following way. We are first and foremost going to learn the objectives of the module. Then we are going to familiarize ourselves with basic concepts of infection prevention. We are going to talk about IPC terminology so that you are facilitated to get into the subject with ease. And also we are going to summarize the background and the rationale for infection prevention and control. We are going to outline the approach to core components of infection prevention and control. We are also going to explore how the World Health Organization core components will contribute to the global knowledge pool on what constitutes a model infection prevention control program. At the end, we are also going to give you the instructions so that you can follow up with the learning what you had through this module. So first and foremost, let us look at what is our learning objective for this module. We as the program coordinators, we would like the learners to comprehend the basics of infection prevention and control, chain of infection, important terminology related to infection prevention and control, understand the core concepts and guidelines developed by World Health Organization expert team. After attending to this module, we would expect the learners to first and foremost define basic concepts of infection prevention and control, understand what is chain of infection, understand key IPC terms, identify the key stakeholders in formulating policy both at national and also healthcare facility level. The learner should also be able to identify the key stakeholders in implementing policy at both national and also healthcare facility level. And post completion of this course, the learner should be able to institute the knowledge in a contextually relevant and appropriate way in their own settings. Before we move on further, let me very quickly introduce you two major topics of the day. One is HAI. HAI is healthcare associated infections and IPC is infection prevention and control. Let me tell you that healthcare associated infections are a major public health problem with a very significant impact on morbidity, mortality, and also the quality of life. In fact, hospital acquired infections, apart from morbidity and mortality, it also has got a huge impact of economic burden on the patients and also the systems and societies in general. A large proportion of hospital-acquired infections are preventable through effective infection prevention and control measures, and hence it is paramount for us to understand these parameters, learn how to deal with them and implement them in our day-to-day life. Now, let me go into what are the basic principles of infection prevention and control. What is infection prevention and control? It is nothing but an application of microbiology in the clinical practice. And infections are usually caused by microorganisms, because usually, if we are going to talk about the microorganisms, there are 300 billion, trillion and trillion microorganisms are there, but not all of them are harmful for us, and not all of them would be causing the infection. We would be having some of the bacteria, fungi, viruses and prions which can cause infections in all our body systems, and those of microorganisms which are causing these infections, we call them as pathogens. So, when we talk about infection prevention and control, we are going to effectively deal with those microorganisms which are pathogenic in nature. And at the same time, not all the infections are transmissible. Some are, like for example, if you take influenza or the norovirus, these are very highly contagious and transmissible infections, which will have a very big impact on societies and healthcare organizations. So, understanding how infections occur and how different microorganisms, what we have mentioned earlier, are going to spread is going to be very crucial in preventing these infections. The process of infection can be represented as a chain, which we are going to talk about in our next slide, where how the microorganisms are moving along this chain creating the infection. Before I move on to my next slide, let me tell you that infection prevention and control is the responsibility of each and every stakeholder within the healthcare system, be it the doctor, be it the nurse, be it the technician, or be it actually the administrative staff. Whoever are working within the healthcare environment, they are all responsible to ensure the patient safety through infection prevention and control implementation of these guidelines and process. So, and hence they play a very key and vital role in ensuring the patient safety. So, let us very quickly look at what are the factors which are involved with hospital acquired infections. We talked about them. First and foremost, these are the microorganisms. We call them pathogens, which are causing the infections, and the host, usually it is the patient. The carriers, it is usually the healthcare workers who move from one patient to other patient while providing the clinical services, and the environment within the hospital, within the healthcare system, and the treatment itself also can be a factor involving with hospital acquired infections, because a misuse or indiscriminate use of some of the antibacterials, antibiotics, etc., also can cause antimicrobial resistance, which can further aggravate the problem of hospital acquired infections. Now, look at the chain of infection. So, if you look at, there are 6 major components of this chain, or we call them as 6 links within the chain. The first and foremost, of course, these are the infectious agents. We have talked about them earlier. They could be fungi, they could be bacteria, they could be virus, and they usually be present in certain reservoirs. Within these reservoirs, they grow, they multiply, and then through the portals of exit, they tend to actually move out like the blood, the secretions, excretions, skin, etc., etc. From there, they would be getting through the modes of transmission, right? They can be physical, they can be droplets, they can be airborne. So through these modes of transmission, they would be entering into the portals of entry. And what are they? The portals of entry usually are the mucous membranes, the respiratory system, the digestive system, broken skin, etc., etc. And then if we had to have the infection going within this chain, we need to have a susceptible host. And who is this host? Typically, these are the people who have got a low immunity. This could be the people who are aged, who have got again low immunity. These could be the patients with chronic diseases like diabetes, where they are susceptible for catching the infections. That is how this whole chain would be closing from infectious agents to the susceptible host. And again, the chain would move on further into the next level from the susceptible host who becomes infected. Again, he would be passing it on to other people. That is how it goes on. So now, before we move on to the major topic of the day, which is the core components, right? Let us look at few of the key terms which we would be using again and again during today's presentation or today's module and further modules which are going to be taken by my colleagues. Few of them I would like actually to bring to your notice, and also I would request actually to memorize them so that it is easier for you to follow what the lecturers in the further courses are going to talk about and comprehend them so that it is easier for you to implement them. One of such key terms is ABHR. It is alcohol based hand rub. As we all know that alcohol is a very potent antiseptic agent. Either it is ethanol or isopropyl alcohol. When you are going to apply to the hands or the skin, it is going to inactivate microorganisms, or it can temporarily suppress their growth, making the hands clean, making the hands safe to provide the care within the healthcare system. The second such term would be AMR. It is antimicrobial resistance. Bundle, what is it? It is an implementation tool to improve the care process and patient outcomes in a very structured manner. HI, we already have talked about it in our earlier slides, and HCW, it is healthcare worker. That is, any individual who is involved with the patient care is called as healthcare worker. ICU, it is intensive care unit. IHR, that is international health regulations. IPC, I am sure by now you very well grasped it already. And then LMIC, that is low and middle income countries. Multimodal strategy. I would like actually to request your special attention to this particular term, because this is going to play a very vital role in understanding the core concepts. A multimodal strategy comprises with several elements or components implemented in an integrated way with the aim of improving an outcome and changing the behavior. These are the key words. Please remember it forever. This is the integrated way of dealing in order to improve the outcomes and changing the behavior. SDG, it is Sustainable Development Goals, which are prescribed by United Nations. SSI, surgical site infections. WASH, again a very, very key term for you to remember, that is water, sanitation and hygiene. WHO, of course, it is World Health Organization. So far, we have looked at the key terms and key understandings which are related to infection prevention and control in our module. Now, we would be talking about another important aspect or important agenda of the day, which is related to the World Health Organization guidelines on core components of infection prevention and control. So when we say World Health Organization guidelines on core components of IPC, what is the purpose of this? That is very important for us to understand in order to comprehend and also implement those core components. World Health Organization has pronounced that protecting patient and healthcare worker lives across the world through excellence in infection prevention and control. So they have also coined, as you can see in the picture, a tagline which says that healthcare without avoidable infections. This is very, very, very important in order to achieve infection prevention and control. So now, why infection prevention and control is so important for global health? Because there are so many subjects within the medicine. From all those, why is that one particular topic which is called as infection prevention and control is so important for global health? Because it occupies a unique position in the field of patient safety and quality of care. I am sure you would all agree with me that without infection prevention and control, it is impossible to achieve quality of healthcare delivery and strong healthcare systems. I would not narrate all those IPC contributions to the global health priorities, but you would understand that both UN and also WHO has recognized infection prevention and control as a major topic in order to improve a lot of global healthcare priorities. For example, like SDGs, like AMR, antimicrobial resistance, which is growing to be a very, very big problem in the world, and also the preparedness for the outbreaks which are happening rampantly in the last decade or so. If we are talking about some of those terminologies which we had been getting through the media, that is swine flu, bird flu, etc., etc. These are the outbreaks. Our responsiveness and preparedness would depend on how do we actually understand the infections and also how do we tackle them. Now we are going to present today the new World Health Organization guidelines on core components of IPC programs, both at the national level and also at the acute care facility level. So you would see that this is the cover of those guidelines which are published by World Health Organization in 2016. These guidelines are a revision or improvement over the guidelines which were issued in the previous years. Now, when we are talking about actually these WHO guidelines on core components, we would definitely can say that this is a roadmap for how infection prevention and control can prevent harm to healthcare associated infection and antimicrobial resistance. So all these two terminologies, again and again we are repeating them. It is very, very important to take care of them. Now the composition of and role of World Health Organization new IPC global unit. This global unit had been working with most of the countries in the world and also the technical experts, and taking the guidelines, taking the guidance, taking the suggestions from all over the world, and assessing actually the guidelines based on the available evidence and expert consensus in order to develop the current guidelines. Now we may ask, there had been World Health Organization guidelines in 2008. So what is that very different in 2016? Why are these new guidelines on core components different, or how they are different from the previous guidelines? The revision of the guidelines was necessitated by the lack of international evidence-based recommendations. Now, this particular revision of 2006 has taken as much of evidence as possible in the world in order to compile them and in order to take them as a basis for providing implementable, realistic, practical guidelines. These guidelines are going to support the countries for the development of their national action plans and also to combat the antimicrobial resistance, and all the field experiences and the research which has gone in the recent times in all the universities and also in all the countries are going to help further advancing the global IPC agenda. So now I would like to show you this slide, again prepared by World Health Organization. I would not actually go through all the elements which are mentioned here, but I would like your attention to be given to one thing, that is new recommendations. What are they? One, there is a focus on multimodal behavior. Second one, there is a focus on WASH IPC integration. We have talked about WASH earlier, and this is very important new recommendation which has taken a important place within the new guidelines, and there is a focus on antimicrobial resistance, IHR and IPC interface. So now let us look at what are those 8 core components which are prescribed by World Health Organization in the 2016 guidelines. According to these new guidelines, we have got 8 core components, 11 evidence-based recommendations, and 3 good practice statements. And I would request you to give the attention that the term or the word or the alphabet R stands for recommendation, and GPS stands for good practice statement. And while actually we are going to understand and also review the further slides, let us give focus and attention especially to those recommendations and good practice statements which are related to the facility level IPC management. Now let us look at individual components of the core WHO. So now let us look at each and every individual component which is prescribed by World Health Organization. Dear colleagues, a very warm welcome to you to e-learning course Infection Prevention and Control, a Primer. My name is Dr.Ranga Reddy. I am a physician, I am a healthcare enthusiast and President of Infection Control Academy of India, and I would be taking one of the 8 modules which are going to be part of this e-learning course. This course is a collaboration between, now the first component relates to IPC programs. This core component is both strongly recommended and also prescribed as a good practice statement by World Health Organization based on all the studies and all the evidence which has been received from all over the world. An IPC program with a dedicated trained team should be in place in each acute healthcare faculty and facility for the purposes of preventing hospital-acquired infections. Today, when we are going to talk about all the other 7 components and this component, I would be focusing predominantly on healthcare facility level rather than on national IPC programs, so that our module can be as practical and as implementable as possible. In order to achieve this core component, as we rightly said earlier, that we first and foremost need to have a dedicated and trained professionals, and they should form a multidisciplinary team, and then this team should have a very clearly defined objective. Of course, the facility management, that is the owners of the hospitals, that is the government machinery, they had to give adequate support to these teams in order to achieve this core component. Of course, having a good microbiology laboratory is going to be first and foremost necessity in order to have this core component delivered. Now, coming to the second component, it is about the guidelines. The guidelines which are evidence based, which are supposed to be giving a overall understanding of how do we implement the systems and processes within our healthcare facility level. This component, in order to be implemented, we need first and foremost the expertise and local prioritization and providing the resources for implementation, then monitoring the implementation, and also we need to ensure that healthcare workers are educated on recommended practices. Coming to the component 3, it is about infection prevention and control education and training. Again, World Health Organization has mentioned this particular component as a very strong recommendation and also a good practice statement. If we look at the success or the key success factors for making a IPC a viable proposition within the healthcare system, we need to really start these programs and educate the people when they are young. That means we had to start the education about IPC from pre-graduate level itself, then continued that through the postgraduate courses, and also give continuous training when the people are in service. We also need to evaluate continuously the impact of the training which we are giving to the people, so that we can keep revising the programs to fit to the requirements and also to fit to the understanding and the psychology of the people who are going through these programs. One more very important factor in making this core component successful is to collaborate with local academic institutions. Going into the core component 4, this is going to be about hospital acquired infections surveillance. There are again we are going to focus on facility level. At the facility level, our people should be having standardized definitions, appropriate methods, a good quality of laboratory support, and quality control in order to have the surveillance in place, and also surveillance as a successful core component. Of course, as we mentioned several times in the past, training and expertise is definitely needed in order to do the surveillance in a way how it is going to give us the enough input in order to make our practices much more better, much more safer. Coming to core component 5, in the beginning itself I have said that your attention is required for this particular core component, which is called as multimodal strategies. We already have talked about the term or the definition of multimodal strategy. The core of this particular component is build it, teach it, check it, sell it, and live it. I am sure with these 5 words you would have definitely understood the essence of multimodal strategies. When we say build it, build actually a system, multiple kind of elements and the components which are to be implemented in an integrated way to improve the outcomes and change the behavior. Teach it, whatever we learn, whatever are the recommendations, etc., etc., try and help your colleagues to teach it so that they also become on par with you. Check it, especially in the healthcare facility level. Unless you are going to continuously do the checking, you are never going to have the improvement. So it is going to be very, very important. Fourth element of it is sell it. Why sell it? When we are talking within the healthcare institutions, sell, probably the people will look at with surprise, but believe us, with the experience within the healthcare system, this is a very, very, very vital element in order to make IPC workable, IPC implementable, IPC to be resultative within the healthcare institutions. If we are not going to sell infection prevention and control as one of the most important issues to be taken care of, and unless you are going to sensitize the people, it is going to be very difficult to achieve the optimal level of infection prevention and control. Leave it. It is understandable. If we are going to only preach, if we are going to sell, if we are only going to teach, nobody is going to actually follow us. We had to set a kind of an example. We had to be the drivers of the change. If we had to be the drivers, we had to live it. That is the only way how we can attract the attention and how we can make people believe in IPC. So now let us look at the component 6. This is about monitoring and audit of infection prevention and control practices and taking the feedback. So we all know that if we had to change a behavior, it is a very lengthy process, and to achieve a behavior change or other process modification, we need to really work very hard with all the stakeholders, sensitizing, educating, and also taking them on our side in order to make it as a successful program. So if we had to do that behavior change or the process modification, we had to do continuously the monitoring and audit, find out where are the gaps, and use that monitoring and audit information as a basis in order to prescribe some of the changes what had to be implemented. And we had to also ensure that we are going to document the progress and also the impact what these core components, what these practices have given for the given healthcare organization or even at a national level. Coming to core component 7, we also need to assess what is the workload, how the staffing is done, what is the level of bed occupancy within a given healthcare facility level in order to prescribe adequate policies and adequate systems for the given institution. There are standards which are prescribed for bed occupancy. Usually it is being said that at least one infection control and prevention person or healthcare worker had to be there for at least 100 beds. If we are not going to have that kind of staffing level, then we will not be able to adequately address infection prevention and control practices with a huge patient workload. Overcrowding is also recognized as a public health issue, especially if we are talking about our government hospitals. Overcrowding is not an exceptional issue, it is a routine issue, and unless we are going to understand that problem and find adequate measures in order to regulate that, we will not be able to provide the right kind of recommendations for the given healthcare system. Then the last component, it is about built environment, materials and equipment for infection prevention and control. So I would not go into the detail of all the environment and materials and equipment, but I would like to definitely make a mention of 2-3 areas which are going to play a very vital role. Number one, that is clean and hygienic environment. We had to have appropriate clean and hygiene environment. If we do not have that, it is going to be very, very difficult to implement infection prevention and control practices. Water, sanitation and hygiene, this is again very important component, and especially when we are talking about water, sanitation and hygiene, having adequate infrastructure, adequate kind of material. For example, if we talk about hand hygiene, we need to have adequate antiseptic preparations available to all the staff at all the places. Water had to be available so that they can wash at appropriate intervals, which should improve infection prevention and control practices within the given scenario. So, colleagues, by now I am sure you would have appreciated and understood all the core components which are prescribed by World Health Organization. Now, let us look at what are the implications of these new core components which are prescribed for low and middle income countries, especially if we are going to talk about India. The major hurdles with implementation of the new core components is, first and foremost, having very limited access to qualified and trained infection prevention professionals in India and other low resource settings. We have inadequate budgets, and hence it leads into huge implementation challenges. And some of these core components which are being mentioned here, they need actually adaptation and tailoring to the local cultural settings. And the local context had to be taken into consideration while we are going to prescribe these components to our healthcare institutions. As been mentioned already, availability of human resources and training, quality microbiology and laboratory support is going to have, or their absence is going to have a huge impact on the surveillance and auditing, and hence we need to ensure that all these issues which are considered to be hurdles in implementation to be taken care of by the respective healthcare facilities and also the national governments. Going further on some of those issues, if we are going to talk about some of the solutions, for example, alcohol based hand rubs, if they can be encouraged to be produced locally instead of actually importing or instead of actually making it very complicated and expensive, that could actually have a very positive impact. Partnerships and partner collaborations, for example, the organizations like Infection Control Academy, it is collaborating with several governmental and non-governmental organizations, and it also publishes the newsletters and journals in order to create the awareness. So, the partnerships and collaborations with various countries is going to give an impetus in order to make the IPC core component implementation within the given country or within the healthcare facility very easy, and it is going to be meaningful for everybody. So, now as I told you in the previous slide, Infection Control Academy, which is actually collaborating even for this program, has got a very vital role to play in implementing the IPC guidelines within India. So, when we talk about Infection Control Academy, it works on various levels, at a policy level, at implementation level, at educating and sensitizing level, both within the healthcare system and also at the community level. So, IFCI does credentialing of the healthcare workers so that they can use not only their knowledge for improving the patient safety, but also use these credentials to move up the ladder in terms of their career progression. So now we have come to an end of this module, and before we close this module, I would like all of you to do certain activities so that all the knowledge and information which is being provided to you can be effectively used for implementation at healthcare facility level. One is, of course, please review the handout which is provided for this module. Read additional material which has been mentioned in your study material. Consider discussing this topic among the participants. I am sure you would get such an opportunity. Join an IPC organization for network and continuous education, because infection prevention and control is a relatively young subject within medical education, and hence there are a lot of developments which are happening in this field, and luckily the awareness about infection prevention and control is growing, which is contributing to safer hospitals and also making the patient stay and patient care much more safer. So you can join organizations like Infection Control Academy, where you would be able to network with the like-minded people who are focused on infection prevention and control, and get the guidance and also kind of continuous education through this organization. And I would also encourage you to actively participate in the discussion forums, which again you would be given the links for such discussion forums in your study material. And if there is any possibility and if you have the access, certainly visit a healthcare facility in order to understand at a practice level how the IPC is being implemented. And please ensure to make personal effort in order to implement the learning what you have from all these modules into practice. And please do not forget to complete the assessment within the stipulated time so that your certificate is not in the danger. Thank you very much for your attention, and I am sure this learning would go a long way in preventing hospital-acquired infections, you becoming one of those pioneering specialists in the field of infection prevention and control. Let us join the hands to prevent hospital-acquired infections and make our healthcare system safer and effective. Thank you. Have a great time. Dear colleagues, a very warm welcome to you to e-learning course Infection Prevention and Control, a Primer. My name is Dr.Ranga Reddy. I am a physician. I am a healthcare enthusiast and President of Infection Control Academy of India, and I would be taking one of the 8 modules which are going to be part of this e-learning course. This course is a collaboration between dear colleagues, a very warm welcome to you to e-learning course Infection Prevention and Control, a Primer. My name is Dr. Ranga Reddy. I am a physician. I am a healthcare enthusiast and President of Infection Control Academy of India, and I would be taking one of the 8 modules which are going to be part of this e-learning course. This course is a collaboration between